Welcome back. It's good to be back from a conference of blood doctors and blood cancer doctors, the American Society of Hematology in New Orleans, and I've got more videos to make about all the things I've seen there. But I want to talk a minute about their mask policy. That's right, this conference, which took place in December 2022, nearly 2 years after a widespread vaccination campaign, had a mandatory mask policy. Unless you were eating, drinking, or talking at the podium, you had to wear the mask, except for one thing. Very few people did it. Very few people did it. I would say about 20% of people were actually wearing a mask despite the mask mandate, and 80% of people were walking around everywhere without a mask. There were a few absurdities that occurred among my colleagues, they told me. One, my colleague was walking into a session without a mask, and somebody who was wearing a mask with his nose protruding out said, "Where's your mask?" And he said, if you're going to be policing masks, you might as well wear yours correctly, okay? I don't have a mask. Do you have a mask to give me? And the guy said, no, I don't have a mask to give you. And he said, so that's it. I'm just going to go in now. Okay. And that's how that encounter ended. Another person told me that they were stopped for not wearing a mask by someone who was not wearing a mask, which is the most absurd thing I've ever heard in my life. I was not wearing a mask and I wasn't stopped by anybody. And I was in the group of 60% of people who were not wearing a mask, despite the mask mandate. And that's the nature of mask mandates. There's a lot of non-compliance, and that will subvert any benefit that could be had. But the truth is, there is no benefit to be had. It's really crazy that we have policies that are not supported by randomized data or even basic common sense year after year. The American Society of Hematology is just capitulating to the most irrational fraction of their members who want to have this stupid policy. If they want to wear a mask, they should be free to wear a mask just like they're free to wear whatever shirt they want to wear, whatever pants they want to wear. They shouldn't make other people wear it. And in fact, they're not, because they can't police it, because no one's going to do it. The moment you exit the halls, there are thousands of off-session events and parties and nightclubs and bars, and nobody's wearing a mask. There's not a mask in sight. This is the dumbest thing ever. Everyone has either had COVID or is going to get COVID. Those are the only two options. There's also a vaccine requirement. They only check the first 2 doses, which you could have completed in December of 2020. Whether you get 2 doses back then or today has nothing to do with whether or not you spread COVID-19. Community masking has generally failed. There is no randomized control trial of masking people for an illness they've already been vaccinated against 2 years later at conferences where you have a 40% adherence rate. There is no trial to guide this decision. This is just plain bullshit. This is not science. How can you be an organization that claims to use the best medical evidence to make decisions for your patients, but use the worst virtue signaling garbage to make decisions for your members at the conference? And then it's riddled with inconsistencies, riddled with just overt non-compliance. Everyone is over it, okay? Throughout this conference, many people came up to me and they said, Dr. Prasad, I love Plenary Session Podcast. I said, you love the episode on Shine? Because it is a really terrible study. They said, no, I love Zebiya Mrozic and your 6 parts on COVID policy. I love your COVID policy. Agree with you. It's pretty brave of you to take that stance. And I said, it's not brave of me to take the stance. Most of you do agree with me. It's just that many people are silent because this irrational minority is controlling the discourse. And I think that's the problem. So Ash, it was a stupid policy, and I don't even want to see it next year. Let's not even pretend anymore. COVID-19 has affected everybody. It's a highly contagious respiratory virus. It cannot be avoided unless you want to live in a bunker for the rest of your life. Once you get vaccinated, lose weight, optimize your medical problems. That's the best you can do. For people who are more worried about it, you have to decide what balance you're going to strike, not just for this winter, but for every year to come, for the rest of your life, whatever balance you want to strike. But don't impose on other people. Don't tell other people what to do. And here, if you're not wearing a mask, don't dare try to police someone. It's a stupid mask policy, part of a broader stupidity of virtue signaling that is omnipresent in medicine, where people tweet one thing and actually do the opposite. And it should be done away with. So those are my thoughts on the mask policy. Next up, I have so many clinical trials to talk about, but I had to get this off my chest because I think this is what everyone there was thinking. Until next time.